The greatest tragedy since perhaps the Civil War is taking place right now in the United States, and most Americans have no clue it is happening. I am, of course, speaking of the opioid prohibition that was brought in by the 2016 CDC guidelines and American media and politicians running to end opioid treatment for all but the most sickly and worst of cases, and for those that are still well connected. This is a hard topic that most Americans have no idea is happening. It is affecting at least 50 million Americans. It affects disproportionately people who are disabled, low income. It disproportionately affects women. It disproportionately affects military veterans. It is a huge thing. It is leading to the deaths of many, at least thousands, the untold suffering of millions. And again, America has no clue. I want to talk about all of this. It's an important topic to me on a personal level, and I will explain that in a bit and more. But first, please go below. Click the subscribe button. YouTube has come out and said it does not want little old journalists like myself, the aspiring people starting out on their platform. So to get over this, I need your help. Please do not let my work be in vain. Help tiny old disabled me to be a success here on YouTube. And as a journalist, I can't do it without you. Due to my chronic pain disability, I cannot work the traditional ladder to become a success. And so I am requiring on you to make me a success. So I can't do it without you. So please subscribe, share, spread the news, share this video. This is really important news. I'm going to talk about some pretty heavy stuff here that needs to get out. So please help me out. All right, so I want to start here with this study that you can find here at this Medical Economics and elsewhere. The study, it was a survey of doctors. It surveyed doctors and asked them, so doctors, what are your opinions about treating chronic pain patients, and how likely are you to treat people that might need opioids? And the survey found 81% of responding physicians are reluctant to take on new patients currently prescribed opioids. And despite the fact that 83% of physicians admit that because of the ongoing opioid crisis, it has become increasingly difficult to treat patients from chronic pain. This is a humongous survey, fairly groundbreaking, in the sense that 83% of physicians in all specialties are scared to treat people with chronic pain and or are reliant on opioids. This is scary. We previously had studies that suggested that people in general practice did, but this is now saying that people in all practices, the vast, vast majority, are afraid to take care of people that might require opioids. And another thing we know about this that's relatively recent, we know that this is called the veteran suicide crisis. 6,000 veterans at least commit suicide every year and have been doing this for at least a decade. 6,000. Many Americans, particularly conservatives, libertarians, people that are patriots and really like the veteran community, are tuned into this. And we talk about the terrible ability of the Veterans Administration, the VA hospitals, to meet the needs, the medical and health needs and mental health needs of the veterans that they treat. But a big part of that we are not talking about is that what veterans are suffering from is often pain. And a recent study shows that veterans that suffer from severe pain, this doesn't even say treated or untreated, but I'm assuming treated, from severe pain are at a much higher risk of suicide. As one of the researchers said, the close correlation between pain intensity and suicide risk and death rates suggests that reducing pain or the perception of pain can help prevent veteran suicide. In this article from the Washington Examiner, Stephen Presley, a 28-year-old Navy veteran, shot himself in April in the parking lot of a VA hospital in Georgia. His mother recalled him telling her, "I don't want to live 50 more years in this pain." Ryan Trunzo, a 26-year-old Army veteran, committed suicide in 2014 after he tried and failed to get painkillers from the VA to mitigate pain caused by fractures in his back. "I feel like the VA took my son's life," the mom told the Star Tribune. This is dangerous stuff. If you may not know, but the Veterans Administration, the VA hospitals, were one of the first people to enact strong guidelines prohibiting the use of opioids in pain treatment. They led the way, even before the 2016 CDC guidelines. And of course, we see that this is a population that is being disproportionately affected by that negative and terrible policy. Veterans aren't the only ones suffering from this. This is affecting people nationwide. As I said earlier, the chronic pain population, the population of people with chronic pain in the United States is between 50 to 100 million. 50 million, we know for sure, use opioids to treat and manage their pain. That was in 2016, before we've had doctors kick patients to the curb. Some studies suggest that this could be as high as two-thirds. Two-thirds of 50 million have been kicked off, had either been abandoned by their doctors or been forcibly tapered from their medication. Two-thirds of 50 million. And if they have untreated pain, how many of them are likely to commit suicide? The reason we are doing this, supposedly, is because we need to stop addiction. There is an addiction crisis in the United States. But the addiction crisis, as Dan Laird, doctor and specialist in this topic, a friend of mine, point out with this cool image, is that the population of Americans that are struggling with addiction, the addiction market, is 2 million. So there, the ball on the left, 2 million. The people that rely on opioids to function and survive, like myself, 50 million. And yet, we are effectively trying to ban opioids. A great article that talks about this by the reporter Maya Slavovitz. Doctors are still denying people with pain meds, and the results are deadly. Insurers and state governments haven't gotten up to speed with federal recommendations, and pain patients are paying the price. Now, Maya is a little slightly wrong on this. She is saying that while the federal government health organizations like the Food and Drug Administration released in April a warning that said that rapid opioid cessation has led to and can cause uncontrolled pain, psychological distress, and suicide, it is not making physicians change course. They aren't the only ones. The CDC the CDC recently updated the guidelines and said that not all pain patients should have their opioids reduced or eliminated. Some might even continue to function best on medication, even at high doses. And just in October, Department of Health and Human Services added to this with a tapering guide that urges physicians to avoid rapid tapers and to consider the needs of individual patients. This is making almost no difference. No doctors are changing course. None. Zip. Zero. Almost none. I shouldn't say none, but many. I mean, they won't bring them back. And why is this? Why are the doctors not coming back to the patients? Why are we continuing to see doctors abandon their patients? Why are we continuing to see the suicide and the heart attacks and the strokes for pain patients that otherwise would not have happened? And the reason, as this article points out, is that the problem is that while these guidelines, while these rules from on high have come down and they're saying don't do this anymore, the state legislatures in the country have already passed laws that severely limit opioid prescriptions, and most importantly, law enforcement, both federal, state, and local, have come down hard on anyone that dares to prescribe. The DEA, even earlier this year, released how it decided what doctors should be charged and what should not for opioid prescribing. And they did it based on pretty unobjective idea that anyone that was above the average of opioid prescriptions would get the hammer, would be arrested. Unfortunately, this does two things. Number one, it forces all doctors to stop prescribing opioids. And as more and more doctors stop prescribing opioids, it causes that average to go down, thus causing even more doctors to not prescribe opioids. Okay, it's a feedback effect. And that forces all these patients to go to pain doctors. And because the pain doctors have much higher averages now of patients that need opioid prescriptions, then the hammer comes down doubly hard on them. And so you get, currently, there are very few doctors willing to prescribe opioids, because if they do so, they will be charged with a crime. If you are charged with a crime, even the suggestion that you might be overprescribing opioids and causing people to get addicted will be enough to destroy your career. And so the doctors are scared to death to do it. At the same time, insurers and hospital systems are encouraging opioids to never be prescribed. An example of this was Blue Cross Blue Shield of Michigan increased the amount it would pay for specific surgeries by 35% if surgeons only prescribed a minimal amount of opioids afterward. This could yield thousands of dollars per procedure for the doctors performing them. An example they said is, say you have a gastric sleeve surgery for obesity, costs $50,000. With this additional payment, that could be added another $17,000. This is dangerous stuff. Currently, though the CDC and other federal agencies are trying to push back a little bit and admit they might have messed up, it is not changing what law enforcement is doing. It is not changing what hospital systems and insurers are doing. It is not changing the pharmacies, what they are doing, because all of them are now pushing for a system where opioids are never prescribed. And this all, as the article points, terrifies doctors. Because even when they have patients who they know are benefiting from doses of opioids outside the CDC guidelines, this is from Kate Nicholson, a friend of mine, it opens up people up to a heck of a lot more uncertainty and a heck of a lot more fear. Even if they're not themselves being investigated or prosecuted, there's going to be more of a chilling effect because there's no certainty there. And as I just said, until we get the DEA out of the business of determining what prescribing practices are legitimate, we will never have appropriate treatment for pain. I know this on a very personal level because almost 2 years ago, I am a disabled man. I have chronic pancreatitis. I was on a stable dose of low-dose oxycodone. It allowed me to function. I ran twice for school board. I worked as a substitute teacher. I was heavily involved in my church and in my community and in my family. Most of that, almost all of that, stopped because my general practitioner became scared about prescribing opioids to patients. She told me point blank she would no longer prescribe opioids to any of her patients. Any of them. She gaslighted me, claimed I was addicted. I wasn't. I was just, I was dependent on the medicine, but there's a difference between dependence and addiction. My point here being, she became scared to prescribe opioids, so she stopped cold turkey. She said she thought about tapering me, but it did not happen. I was just dropped like a rock. A very difficult non-taper for me to go through. I went through withdrawal. It was a horrible experience. Even my new pain doctor that I currently have is scared to prescribe opioids. She told me that she understands I need them. I need them to treat my pain, but she will not do that because she's had DEA agents visit her clinic on multiple times and tell her that they are watching her and that she needs to keep her prescribing levels down. I have another friend, another specialist in the pain field, who when talking with a DEA agent and says, look, your practices are causing a lot of people to be harmed. And the guy basically told him, I don't care. We don't care. We have to get these drugs off the streets. We don't care what happens to chronic pain patients. Now, I could go into the numbers about how many people are being affected. This is there is some argument here. It could be as high as 72,000, but it's probably more like 30,000 are dying every year from opioid overdose. But the vast, vast, vast majority of that is from illegal drugs, fentanyl, not prescription drugs at the slightest. But it doesn't matter. People now believe fully in the media and in our governmental agencies and in law enforcement that it is prescription opioids are to blame, even in my home state. It is a picture of prescription drugs that is on all the campaign materials for their anti-opioid health campaign. It is all taking place, and it's dangerous for people to push back against this. And look, the way that the government looks at this is this way. They say that the opioid, this is from the White House, the opioid epidemic cost $2.5 trillion over 4 years. They believe the opioid epidemic is costing lots of money. And to politicians on the left, they look at the opioid and the vaping too. They look at the opioid epidemic and vaping as a way to hurt capitalism. Okay, what did Kamala Harris and the rest say at the Democratic debate just last month? They said that these people these executives at these pharmaceutical companies are nothing different than highly paid drug sellers. Okay, they're no better. They're scum. They're just highly paid illegal drug sellers, drug pushers, I think is the term that Kamala used. So all the incentives right now are for not prescribing opioids and going against them. The companies that are being held to task. I had an article from the Washington Post where the person argued, how much money will it take for the opioid crusaders to be pleased? And the answer was, there isn't one, because there will never be enough money to pay back the people that want this, to pay the activists off, to pay back the people whose family members were hurt by opioids, the addicted, etc., etc. By the way, rates of addiction for prescription opioids is incredibly low. It's less than 1% in most counts. Well, I'm going to end it here. I'm going to come back with another video because this is all happening at the same time that America is trying to create its own social credit score system that's tied to your health. And they are using this partially to prohibit people from getting opioids. I want to get into that in the next video. So I'm going to stop this video here and come back with another. But please, if you haven't yet, subscribe and share this video. Let's get this information out there. I appreciate your help and support. You guys are awesome. Be back in a bit.